What we are recommending is strategies that will sound very familiar to most people because they are things we've been recommending really since the beginning of the pandemic. These are strategies that we know are effective in reducing the transmission of this virus. They include things like physical distancing, so maintaining at least 6 feet of distance away from others, wearing a mask. We know that people, even without symptoms, can transmit this virus, so having everyone wear a mask is a really effective way to reduce transmission within our communities. Also, hand washing. Other strategies specific to schools include things like staggering of schedules to avoid congestion, so not having a lot of people present in the school setting at the time of drop-off or pickup can help reduce the risk that you might be exposed to someone who's infected or risk of transmission of infection. Another strategy has been cohorting of children or keeping children in pods. This limits the number of other students that they're exposed to and also limits the number of people teachers are exposed to as well. This is very helpful in the situation that a child tests positive or a teacher tests positive. You then have a defined group or smaller group of people who may be at risk. And so if quarantines or things like that are required, it is a smaller group and a known group of people that would need to do that. Any child who has any respiratory symptoms, even if it seems minor, like a mild runny nose or a sore throat, should not be attending school because that puts other children in the school setting and other teachers in the school setting at risk for becoming infected. Before any child returns to an in-person school setting, we would recommend parents touch base with their primary care provider to ensure all of their child's routine vaccinations are up to date. This year, more than ever, influenza vaccine is recommended for anyone over 6 months of age. The symptoms that influenza causes are indistinguishable from those that COVID-19 causes. So you cannot look at a person and say whether they have influenza or COVID-19 without doing a specific test. And so anything we can do to reduce the rates of influenza, reduce the circulation of influenza within our communities over the next school year will be very critical, and vaccination is one of the most effective ways for us to do that.